Welcome to Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of Cambridge Health Alliance, including the PACE program. Today we have Dr. Chris Simons with us. Dr. Simons is a doctor at the Revere Health Center, 454 Broadway. And Dr. Simons, tell us what you do. You're a family practitioner?
Yep, I'm a family physician over at the clinic. And I see patients of all ages, from the littlest babies to the oldest adults.
And anyone in between.
Everyone in between.
Yep. So we have a lot going on at Revere Health Center. We're expanding the Women's Health Department over there. And can you tell us a little bit about that? What's going on? And heck, we actually have an event coming up.
Sure. Over the last few years, we've greatly increased the size and capacity of the clinic for primary care patients, and most recently this year expanded the women's health services down on the first floor. And we'll be having kind of a relaunch open house event coming up on September 30th that we can get you information to on our website.
And so the expansion of women's health, do you know by any chance what it includes, or how has it expanded?
So we've expanded the physical space, almost doubling in size the amount of rooms, and adding more doctors and nurse practitioners and midwives to provide a whole range of services, pretty much all the women's health services that someone would need between us in primary care and the gynecologists and midwives down on the first floor.
That's wonderful. So we do take the pregnancy and the birthing and the whole thing of the babies over there.
And any health care needs for a woman throughout her life.
Yeah, throughout her life. Even for the geriatric population,
Yes.
right? Yes, we're not excluded there. So you have room. I think you docs over there are, because of this expansion, you're able to take new patients?
Yep, between myself and the other 6 doctors and all our team members, we have plenty of space to take extra patients in primary care and in women's health. So definitely look us up and come on by.
That's great. So, you know, Cambridge Health Alliance has changed quite a bit over the years, and we have expanded in many, many different ways. The Everett Hospital, which was formerly the Whidden Hospital, is now the Everett Hospital, and there have been many, many big changes up there as well. And folks in Revere should get to know us because we're the community hospital. So it would be important, and that would be me that you would contact, and we could be able to do a tour and whatever up there as well. So let's see. Maybe this is a good time for me to mention that although there's a family practice at Revere, Cambridge Health Alliance does have a lot of services for different programs for older adults. That's what they call us now. It's much more forgiving. They don't call us elder or senior anymore. The boomers don't like that. So they now call us older adults. And we have a variety of different programs, including that PACE program I told you about, which is for folks that are frail and want to stay home and out of hospitals and nursing homes. So I think it's important to mention that to the community as well. So, Dr. Simons, what else can we find out about what you do at the health center, or what other docs might do at the health center?
Sure. So myself and the other primary care providers at the center see patients, like I said, of all ages to help treat their illnesses, but also try to prevent problems that can come up in the future, and to keep people on the path towards wellness, or keep them well when they're already well. So both coming in for healthy visits, physicals, and preventative visits, but also sick care visits when someone has an illness or a chronic medical condition that they need some help with, like diabetes or high blood pressure.
You can monitor those. So I think it's very important, something you touched upon, that the entire Cambridge Health Alliance is focused on preventative health. You know, the elder population, the people in their 80s and 90s, you know, we didn't work with preventative health. It's like when something broke, we went to the doctor and we got it fixed. And then we just sort of waited for the next time, and when something else broke, we went to the doctor and we got it fixed. But today the focus is really on preventative health, right? To maybe go to these doctor visits and make sure that everything is doing what it's supposed to be doing, and all your levels and your blood pressure and your sugar levels and things of that nature are where they're supposed to be. So, and if they're not, then you can kind of catch it early, right?
Absolutely. So both anticipating problems that might come up based on the health in your family, or making sure people are protected against various things with their vaccinations, or screening for things that may come up like cancer screenings, mammography, other things. All these things is part of our job as primary care doctors to help think about with people so we can be best serving any needs they may have now, but also for the future.
You know, I want to mention one thing. You just triggered my memory. Believe it or not, I am still finding people out here in the community that do not have a primary health care provider. In 2017, it seems unbelievable, but it's true. So I want the primary health care provider is the navigator through the entire healthcare system these days. Is that correct? You oversee everything. The whole umbrella of in each department that people might go to or be involved in. Is that correct?
Yeah, the way I like to think about it is we're in charge of thinking about the whole person. You may have one specialist, doctor, another who's very focused on making sure your heart is well, or another person in your life that is helping you with your housing or other needs that you have. But I think our job is to kind of help think of the whole picture and prioritize how we can help get you connected to the experts in each area when needed and when you're beyond what we can do for you at the clinic, which is a lot these days, and make sure that you are connected to everything that we can possibly offer at Cambridge Health Alliance.
And the medication, too, I think is a huge thing, that if a heart doctor or another specialist might prescribe a medication for someone, you are at the helm of that whole thing, right? You know if one medication might interact with another medication or counteract another medication, or, I mean, there are adverse reactions that we can have to medications as well, and so you oversee things of that nature as well?
Absolutely. So through kind of the relationship that we have with someone over time, we get to know people over a long time, and we're hearing about any changes to their health plan that they've made with some of these other doctors or other parts of their life, so we can play a role in safety, making sure the medicines play nice together, or if they don't play nice together, what we can do to change that, as well as making sure that we're not forgetting these important prevention activities when as naturally we're focused on some of the problems that we have in our lives, making sure we're thinking about some of these ways that people can get towards health or stay healthy if they're already healthy.
Right, for sure. And pharmacy also plays a huge role in that, and I'm always suggesting strongly to people that they only use one pharmacy. That way the pharmacist is also a double check on medications that are being given.
Absolutely.
It's a good rule of thumb, I think. So you have a project that is near and dear to your heart, and something that was institutionalized with you because you found a need. Is that correct?
So yes, so one of the projects that we're working on right now at the Revere Care Center and across Cambridge Health Alliance is making sure that patients have enough food. So we found that a lot of our patients that we serve are struggling with a day-to-day worry about whether they're going to have enough nutritional food in their lives, whether they're actually running out or whether they just worry about running out. And that's something that, as you can imagine, right before lunchtime, people are thinking about, we can all empathize with. But if that's something that you're thinking about throughout the day or throughout the week or throughout the year, you can imagine that comes with other problems in your life, choosing between putting healthy food on the table for yourself or your family and going to the doctor, or paying for your medicines, or you know, having fun outside of your job or the health center. So we always have known that in the United States there's a problem. I think the last data I saw was 1 in 7 people worry about this.
Isn't that incredible in this day and age?
And in Massachusetts overall, we do a little bit better than that, maybe 1 in 10, but I would argue that's still pretty high. And locally here in our county, it's more along with the national data, around 1 in 7. So I think what that means to me is when I'm walking around my neighborhood here in Revere, or when I'm out at dinner, there's dozens of people around me that are silently struggling with this. So in line with some of the work done at some of our other clinics in Cambridge Health Alliance, we've started making sure that we're asking our patients about this, making sure we're helping patients get connected to various resources that already exist in the community so that we can help to change this. As one clinic or even as one healthcare organization, we can't be the answer to all of this, but we can use our place in the community, and we can use our place, you know, sitting down face to face with someone, talking about their struggles to find out that this is something they're dealing with and help.
It's something that maybe without asking, they may not be offering that information to you, right?
I think some people don't necessarily connect it with health, or some people are embarrassed to talk about it as something that they're dealing with for financial reasons or for other reasons, but I think it can directly impact how your health is, both taking care of what you're eating, nutritious foods that can affect your chronic diseases like high blood pressure, diabetes, but also can play into all other parts of your health. It can affect kind of your teeth and maintaining good teeth throughout your life, and it can play into these choices about whether you're able to afford and take your medicine. So I think it's critical that we think about some of these social factors that can affect how people are able to take care of themselves and their families.
For sure. So do you do a survey with your people?
So we originally started with the collaboration from the Greater Boston Food Bank, and we did a few-week screening of all our patients when they came to the front desk to check in, just to see how big of a problem this was. I don't think we have great data for our Revere area yet. So we wanted to kind of see how big of a problem this was, and we found that almost half of the people that came to the clinic during those few weeks were worried about it.
Almost half?
Which is staggeringly high number.
It is a staggeringly high.
So we've started, after that pilot project where we kind of talked to everyone for a few weeks, we've started at some of our wellness visits when someone first comes to the clinic or when someone comes in for their physical or their well child check. Seems to flow naturally with those visits to ask about some of these things in their lives that can affect their health. So we've been asking at those visits, and if people tell us that they're running out of food or that they're worried about running out of food towards the end of the month, that we can then take steps to help connect them with other agencies that will be able to either connect them to local and state resources or to independent organizations in the community that have extra food. So there's a lot of different ways we can help someone with this worry.
Now you mentioned the Greater Boston Food Bank. Are there other resources that you know of in the community that could be, just to let the folks know that they're out?
Absolutely. In our local community, we have food pantries like over at the First Congregational Church on Wednesday nights where people can go and get free food when they're in an emergency situation and running out at home. Longer term options, we sometimes refer patients to an organization called Project Bread. People might know of them from the Walk for Hunger that they put on every year, but they also do a ton of work with connecting to the local agencies in the community like the food pantries and food banks and other organizations to help connect someone near to their house with resources for their food, both money potentially through SNAP or the food stamp program, whether it's getting someone connected to Meals on Wheels or elder services so that someone's coming and bringing food, or whether it's giving community-specific things like coupons to the local farmers market at the mayor's office in Revere, or getting people in connection with the food pantries at local churches or other areas.
So the resources are far and wide.
There's a lot of different resources to pull together, and that's why we are trying to connect both from the clinic and getting people already positioned in the community like Project Bread to help patients find these resources that can be spread out. I'm not sure we have enough resources yet, and hopefully over time as a city and a state we'll be able to build more and more. But I think there's a lot out there that you may not be aware of if this isn't something you've ever thought about or asked for help for yet.
Right, or had to worry about it.
Luckily.
Yeah, because things happen, right? Things happen, things change, people lose jobs, people get ill, people have children. Now, you know the WIC program?
Yes.
I work with the elder services, so I don't know a whole lot about the WIC program, but do they have food, don't they?
Absolutely. So WIC can provide additional financial money benefits to families with small children, or women during their pregnancy even, to help make sure that we're providing an environment where people have enough nutritious food. So that as a supplement to whatever else they're able to put on the table, there's extra money to get nutritious food, and there's that connection and other services in this time of transition in their lives when they're pregnant or have young kids at home.
Right. Right. So it's good. You know, I've been with the Cambridge Health Alliance I've just celebrated my 11th anniversary. And it always amazes me, and that's one reason I do this show, because it always amazes me for a community hospital, the depth and the breadth of the things that we do here. It was on my show that I recognized that we are a accredited cancer center, and that we are an accredited stroke center, and at the Everett Hospital we have now pulmonary rehab, and that we have a sleep lab up at the Everett Hospital. It's like, you know, we do a lot for the community, and we make sure that we care for the community.
I think we try to bring as much as possible to people closer to where they live. I mean, a lot of patients are walking to our clinic or taking public transportation to the clinic, and if we can provide a service there, or if we can provide another connection to a service that's already existing in their community, I think people are much more likely to be able to take advantage of it.
It's true.
They won't have to drive around to all these different places. I think we try to be a medical home for some of these patients, as many of these patients as we can be, so that they're coming to us for sick visits, and they're also coming to us to let us know all these other factors that can impact their health.
Right. And you know, I think you're right. You touched upon one thing. When we talk about health and health-related services, all of these other things, the health-related services, that if we don't necessarily think of them or haven't thought of them in the past years as supporting health, but they absolutely do. And you mentioned teeth, and if you don't have the nutrition, and if you don't have the the teeth to be able to chew the food, then it's all a problem. It all needs to be dealt with, right?
We've tried to, as much as possible, fold this stuff into the clinic. We now, over the last several years, have had a community health worker at our clinic who is able to go with patients to some of these places if they haven't been to some of these places before, or assist them in getting connected to some of these services in the community as well. So she's been invaluable to some of our patients that need a little more help navigating the system that can get really complex really quickly.
Right. These systems out here are very complex, and we definitely need someone to advocate and help us through the entire complexity of all of the systems, whether it's healthcare or whether it's finding food or whatever else people need. You mentioned being in close proximity so people could get to us. Many people don't have vehicles, so that they definitely depend on mass transit, or if they have mobility issues, then mass transit might not work so well for them unless they can get connected to what we call, you know, if they're older and they have the necessary requirements, then they could possibly be connected to the ride, and which does help get people around to visits and things that they need. So it all plays a factor. If they can't get to the doctor, then they're going to be home not being treated, and maybe isolating, and then with isolation comes a whole host of issues. Like in my experience, what I've learned, because it's the geriatric population I work with, it's that once they start withdrawing, then they're sitting on the couch, they're watching television, they're not moving their muscles turn to jello, and the less they move, then the less they're able to move, and then it just goes on. And then let's not forget the depression that could roll in when someone is alone and isolating, and for whatever reason they are alone, whether they don't have friends, whether they don't have family, whether they're not able to get to the doctor. We can help them with all of those things, can't we?
Absolutely. I think that's part of the benefit of having a doctor that you get to know over time, that builds a relationship with you in the primary care office. people can notice when these changes are happening, or when we haven't seen you for a little while, or when
Or you don't see you,
yeah.
right? If you're not making your appointments.
Our teams are helping with calling patients that we haven't seen in a while to say, hey, you might be due for this test or this other test, or we haven't seen you in a while. Do you want to come in for a visit? So there's a lot of different layers to the office of team members who are helping directly when the patient is there, team members that are trying to catch some of the patients that we haven't had come in for a little while that may be in need of things, or that maybe in the situation you described where they're kind of withdrawing a little bit, and maybe that reaching out a hand will get them back connected.
Right. Do they readily admit if their mobility is affected and they can't get there, or if they can't afford to take mass transit, or do you know whether they readily admit that when someone makes that office call?
So I think it kind of depends. So some people are embarrassed about their limitations that they've developed, or that that they're worried about being judged. So as much as possible, we try to be curious and investigate what's the reason they're not coming in. You know, did they have a family emergency come up and they had to miss the appointment, or did something change where they need a little extra support, and maybe we need to connect them with a different resource if they need more care at their home, or if they need help getting to the clinic, or it could be a number of things. So we try to ask, and oftentimes when you're part of that relationship with someone, you know the medical assistant who brings you into the room every time. When they're calling you at home, people are more likely to open up about some of those more sensitive subjects.
True. So I think it's important to also mention and to tell the folks out here that we're here to help. We can't help if you don't tell us, right? And I know that especially for the proud elder generation, you know, they've lived through some tough times over the years, and they're proud. And they don't want to admit, but you know, please reach out. Reach out, because we can help you, or if we can't help you, we can connect you to someone who can help you. But we can't help you if we don't know, right? That's the essential thing. I think it's important maybe to just let the folks know that we can serve people of all languages. We have, I'm sure you have culturally diverse staff members over at Revere, but we also have access to interpreter services at the Cambridge Health Alliance.
Absolutely. I think maybe at least 1 in 3 of my visits are in a different language with the phone interpretation system. So I think we can meet the needs of anyone who's walking into the clinic, whether you need an interpreter or not. Right. I think we want to make sure that we're providing care in a language people can understand, even if that's English, and explaining things at different levels. So
that's a good point that you mentioned, even English, and not talking over their heads, but talking in terms that they might be able to understand. That's one thing I love about the docs at the Cambridge Health Alliance. They're all very good. Every doc that I've had on my show or brought out to the community, they're very good at talking to the people in terms that people understand. If they get a little academic, I say, can you translate that for them? So I think it's an important point that you mentioned.
Yes.
Right, even in English. So let's see, is there anything else that we can tell them about the clinic that I might not know about, or that we haven't touched upon?
Sure. So we've been in the Cambridge Health Alliance has had a clinic here at 454 Broadway for about a dozen years now, I think. So we've continually tried to add some services, with both expanding our primary care doctors and our teams, and the Women's Health Center. You've heard about the food project, and we keep trying to expand services around food and other social things in patients' lives that might be impacting their health. So we've recently also got kind of emergency food services, or emergency food supply for patients that at the visit tell me they're out of food, or running out of food for that week. So we've been lucky enough to get some charitable donations from various organizations in the area to provide someone with something to walk out the door with. So even until they can get connected to Project Bread or walk over to the local food pantry, they have something to take home with them if needed.
Wow, that's wonderful.
So hopefully over time we'll see an expansion both of resources that we can bring to the Revere area, and keep identifying different community partners that will be able to open up their resources for patients in the area as well.
So I think this is all hugely important. Do you connect with at all with the Board of Health?
So we haven't made an official partnership with the Board of Health around this issue, but of course they're involved with all of the health in the city, so that's
Right.
definitely an area we may be able to explore.
I might be able to help you with that. I have a connection over there. That's great. I want to take this time also to mention, as I alluded to, some of the services that we have for, or maybe I should first tell you that the Cambridge Health Alliance is now comprised of Somerville ER, the Cambridge Hospital, the Everett Hospital, which was formerly the Whidden Hospital. That's going to be a challenge getting people to think of it as the Everett Hospital, but it certainly makes sense. The 12 primary health care centers, the Public Health Commission in Cambridge, as well as Beth Israel Deaconess Medical Center. So that's our Boston affiliation to hospitals. I think that's important for people to know. Not everyone is aware of that in the community. Also, we have programs on board for folks that might be homebound in the community, the house calls program, if they cannot get out to see a doctor. So that's important. Your health is important. Health is wealth. Without our health, we have nothing. And so we definitely want to address those situations. So please let us know if you or you know anybody that might have need of that. We also have the Geriatric Psychiatric Program, which is at the Everett Hospital. They do a fabulous job up there. And they are both a medical program as well as a psychiatric program. And that's for folks 55 and over that might have need of that unit. And first they can check out to see if there's any medical condition that might be underlying someone's, say, behave in mental status, a change in behavior issues that they have. And then we have a PACE program, which is Elder Service Plan. And that's for folks 55 and over that are frail and have needs with things like bathing dressing. They don't have to be homebound or bedridden, but they do have to meet the clinical criteria. So we're happy. We have programs for everyone at every age and to help people with whatever they might need to address the health and health-related situations, which you've really so aptly pointed out to the folks that the Revere Health Center is being instrumental in forerunning with all of these things in the community.
So I think it's definitely part of my job as someone's primary care doctor to be knowledgeable about what we have to offer at Cambridge Health Alliance and to connect people. So I think, like you said, when people are able to come into the clinic and see me, that's great. But if they're at a place where they're not able to and they need more care at home, I can make the connection to the House Calls program or other programs that we have so that people can still move the process of their health forward.
That's right.
Continue to be healthy at home or to continue to move towards that.
Right. Well, I want to thank you so much, Dr. Simons, for coming on board. I think that certainly I've learned a lot, and I think that hopefully the folks in the community have learned as much. Thanks so much.
Thank you.